A mother and son in the same hospital. The son would hear the call go out that his mother did not make it.
The other week, as I was making rounds, we had a code blue called.
Dr. Thomas Yadigar describing what has become all too routine in hospitals across the Southland. COVID patients succumbing to the disease. But this patient was different. It was an older woman. Her son, also sick with COVID, was in the same hospital.
I went to another floor to see more COVID patients, and I was greeted by the sound of a grown man weeping, wailing, crying. It turned out that the person that we had coded and lost was his mother. He had just heard her room number and knew that she had a code blue.
Tonight we spoke with Dr. Yadigar, the chief medical officer in the ICU at Cedars Providence Tarzana, about how he and other frontline healthcare workers process tragedies like this one.
And it was difficult because, obviously we go to a lot of code blues, and unfortunately, we do have our fair share of patients that don't make it. And you always wonder what it's like for their families on the other side.
With COVID cases and deaths reaching record highs in Los Angeles County, doctors and nurses across the area are pleading with everyone to heed the warnings. COVID is a real threat, and hospitals are being pushed to the brink.
We really are at a breaking point. We are setting records every day in terms of how many patients we're caring for who have COVID-19.
Governor Newsom is deploying the U.S. Army Corps of Engineers to a half-dozen area hospitals. Oxygen delivery systems will be assessed and upgraded if needed. This comes at a time when many hospitals' internal oxygen delivery systems are being overwhelmed by the volume of oxygen flow required to treat patients with respiratory issues associated with COVID-19. And members of the military will go to Arrowhead Regional Medical Center in Colton to help with the surge there. FEMA deployed 75 medical workers to Arrowhead, as well as 3 other California hospitals. The doctors and nurses are from Travis Air Force Base and Fort Carson. Amid all of this grim news, there are a few kernels of good news to report.
It was a little bit slower yesterday than it has been the past 2 weeks.
Dr. Stephen Kim is the chairman of the emergency department at Riverside Community Hospital. He says the slow New Year's Eve delivered some relief to his staff. Just last weekend, to help with the surge, they started preparing alternative care areas, converting the hospital cafeteria to treat patients.
Anytime we have a little bit of a break with the number of patients coming to the emergency department, it gives our staff and our physicians and our nurses a chance to just sort of recharge.
The man we told you about at the beginning of this story, who was with his mother in the hospital, he did survive and is now at home recovering. I'm Tom Waite, KCAL 9 News.